drops, but or maybe samples every so often, but you have to go to the drugstore. So
doctor's offices have pharmacies in them now.
Well, they're also.
Wouldn't it be as simple as stopping that and making them write scripts and going to a central place with a central system?
That's another piece of proposed legislation, is that the physician, right now, to be a dispensing practitioner, you pay, I forget what the fee is, it's a ridiculously low fee, in addition to your regular licensure fee, and then you have to take, a couple of hours additional continuing education, and then you can dispense whatever you want. You've got to keep the appropriate records, so on and so forth. One of the proposed bills that they're looking to do is to limit on these medications how many pills can be dispensed in a physician's office at any one time. So they're trying to limit it actually to a 72-hour emergency.
Right, like samples, sometimes a lot.
Well, not necessarily samples, but you can sell them a 3-day supply.
And you go.
And then give them a prescription.
Exactly.
Not 3 months,
Yeah.
which is
I
what
mean, it seems like it would be as simple as eliminating that and then going into a central system with it being tracked, and the same person can't continue to go to different places to get medicine.
And that's what we're
Walgreens, CVS, they're all connected.
What we're trying to do right now in the state of Florida is not only, well, we've signed into the legislation and the law, prescription drug monitoring bill, which is now a prescription drug monitoring program. We have that signed in. However, we're still trying to implement it because of funding. And again, it's being really undermined right now by this new bill, House Bill 225. So to answer your question, you're right. That's what should be done. And unfortunately, we're trying to do it. And there are forces out there that are making it difficult.
Something else we have not touched upon yet tonight is the fact that many of these people who get these drugs at the clinics use them in the parking lots. I mean, they are in such desperate need of these drugs that they can't wait until they get behind closed doors. And so they are in the parking lots of shopping centers all over South Florida, and they are shooting this stuff up, they are snorting this stuff, and then they are driving. They are on the highways with us and our loved ones. And some of them are heading back to other states. Others are heading back to their homes here. But the fact is they are horrifically impaired and endanger every single one of us. And we see that on a regular basis.
That's an increased problem that law enforcement is recognizing, that it's no longer driving under the influence of alcohol, it's driving under the influence of drugs. And in a state where we have 6 or 7 Floridians dying a day for prescription drug overdose, I think the real key issue that we have to look at is we have to start looking at our lawmakers. Why for years were our lawmakers not voting to enact the prescription drug monitoring bill when we know that 35 other states have enacted and it works phenomenally? John said it before, politics is money, and we have to start looking at it. Who are the people that are influencing our lawmakers?
Good question. Maybe a good story. You think? Yes, sir.
Well, has anyone tracked the campaign contributions to these lawmakers?
Let's start with John May.
Yeah. Good idea.
For example, do we know whether his campaign contributions come from the drug manufacturer or even from the owners of the pill mills?
In his case, it's actually very confusing because originally he was a person who voted to have this our original prescription drug monitoring bill signed by Governor Christie. And now he's proposing legislation that looks to undermine it. Obviously, you have to start looking at who's really going out to undercut these bills. And I think we do need to start looking at people like Representative John Legg and ask the question, well, why are you doing this? Why are you doing this when it's really a public health issue where we're having so many people die? Why?
The other thing is that the Broward Sheriff's Office has been really pretty aggressive in terms of the buy-bust things, the street narcotics, because they said, a lot of these people, they get the prescription pills and then they sell them. They say that they keep part for themselves and then they sell part. And the Broward Sheriff's Office has been extremely aggressive with that. But the flip side of that is that the people that they're arresting are now in our jails, and our jails are already full, and they are going through our court systems, and our court system's already full. And these aren't just people from Florida, these are people from, what we call the pill pipeline states, Kentucky and Tennessee and Ohio. Not the only places, but those are like the three main. On my way here tonight, I was behind a bunch of kids in a junkie car from Kentucky. And I can tell you exactly where they were going. They were going to a pharmacy here in Dayton. And I know exactly where it is. And it's one of those pharmacies where don't ask, don't tell. And the word goes out and they know exactly where to go. Like the place I mentioned earlier in North Bay. 25 or 30 people in a parking lot, milling around waiting to have their prescriptions filled. You can't, the major pharmacies are not filling these prescriptions. They will not fill them and they just don't even look at them. It doesn't matter where you're from. So, and once again, I guess that's a whole issue with getting legitimate prescriptions filled from doctors who are treating pain.
And then you bring these people